Good evening, everyone. During the course of my internship, I have learned many things that would be a benefit to the company, but the one I will be focused on is the future of healthcare in Pakistan. Before we dive into the concept of healthcare in Pakistan, let's first look at what healthcare is. Healthcare is often considered the maintenance of the human body. This can be referred to as two different things: well-being and wellness. Though they sound similar, they are actually two very separate things. Well-being refers to a more holistic whole-of-life experience, often compared to emotions and the mental health of an individual. Wellness, on the other hand, refers to the specific health of an individual. It is the job of the healthcare provider to provide care for wellness, but to support well-being. So let's talk about who is involved in healthcare. The first area to look at is the medical professionals. These include doctors, nurses, LPNs, LVNs, specialists, and even CNAs and aides. Another group involved are the pharmaceutical companies. This includes everything from the pharmacist, to the pharmaceutical reps, to the actual companies themselves, and even to pharmaceutical researchers, developers, and manufacturers. The final party to consider is the insurance groups. Now let's look at the levels of healthcare in Pakistan. The chart below describes this. There are 3 levels in the healthcare system: primary, secondary, and tertiary. In the primary section, we see lady health workers, health houses, and basic health units upward referrals to 2-inch care. These also include the village doctors and primary care physicians. The secondary level involves rural health centers as well as general hospitals. The tertiary is reserved primarily for well-equipped teaching hospitals. Oftentimes, in these teaching hospitals is where experimental treatments are performed and tested. We will now look at healthcare in Pakistan. This will involve the current situation in Pakistan, pharmaceuticals, and cultural barriers. The current situation in Pakistan in regards to healthcare is not where we would hope it to be. There are many things that could affect the overall health of the population. This includes the poor living conditions. Unlike some of the world's larger nations, Pakistan is often a threat to contaminated water sources and food. Throughout the course of its history, there have been many outbreaks of different viruses and infections because of this. Whenever a resident becomes ill, rather than calling up their physician, making an appointment, they have to rely on barely functioning medical camps and houses. In most situations, they are not well equipped, nor do they have the supplies needed to help everyone in the area. Though the government has some programs in place, such as their national healthcare system, there is very limited help given from them. They often provide low-cost, low-quality services and supplies. There has been a lot of debate about micro-insurance groups. Unfortunately, these are flawed. The concept of insurance is that everyone puts in a monthly premium, and the amount of actual need of the group is so low that there is still plenty of money in the event of a major accident or ailment to cover another. Unfortunately for Pakistan, the need is higher than the amount that can be put in by those that need it. Microinsurance groups attempt to help clients, but oftentimes either the insurance group or the medical professionals themselves cannot provide the help that is needed. Another dilemma that Pakistan faces is actually in their pharmaceuticals. Pharmacology is the study of drug interactions, whether man-made, natural, or within the body, and the effects that they have on the human body. In the previous slide, I mentioned the recurring viruses and diseases that Pakistan is often plagued with. One of the reasons they continue to reoccur is because of pharmaceuticals. Pakistan is in a dire situation where they are unable to get a hold of a constant supply of high-quality medications. They are even unable to get a constant supply of low-quality medications. When a medication in the form of a pill expires, it's not entirely useless, but its overall effect is not at the level that it needs to be in order to wipe out the infection or make a difference. Pakistan has access to a very low cost and low quality medications. Because of this, they do not always provide the help that is needed. Though the demand is large, the supply is very limited. Oftentimes, nurses and doctors will prescribe medications even if they are unable to be given. Every day there is a limited supply that the hospital can give out. For example, we see this with hepatitis C and polio outbreaks, and have occurred in years past in Pakistan. These diseases and others like them often require multiple doses throughout the stages of life to be given in order for it to be effective. Unfortunately, though, in most situations, only 1 or 2 doses can be given. The same occurs with antibiotics. If a 10-day supply is needed, they are limited to only a few days' supply. When a nation's citizens are in trouble, they often look to the government for help. Unfortunately for Pakistan, it is restricted. It often comes in the form of low-quality medications that do not completely wipe out the disease and ailments of its people. Like all nations, culture plays a major part in its roots and foundation. Unfortunately, this does not always help its people. When we hear of Pakistan, we often think of the abuse that women have to go through. But in healthcare, women are often found to be the nurses and aides who assist and give comfort in Pakistan. When it comes to receiving cares, however, this is where things change. Women are often considered second-class citizens and are, at times, denied cares for things such as birth control and obstetricians. If given permission by their husbands, then some physicians will give out the needed medications or cares. Between 2012 and 2013, Pakistan Demographics and Health Surveys data was used to measure prenatal, delivery, and postnatal care of women in Pakistan. The 5 outcomes that were measured included prenatal care during the first trimester, 4+ prenatal visits, skilled birth attendants present, delivery in a medical facility, and receiving postnatal care. Less than half of the births result from the mother received prenatal care in the first trimester. Only a little over half of them had trained personnel at the delivery. However, over half of the children born were to the mothers who received postnatal care. Unfortunately, another factor to consider is actually the abuse of women. There is an actual controversy as to whether women who are abused should receive medical help for the sole reason that it is within the husband's right to administer discipline and care. Culture can both promote and hinder a nation's progress in the modern world. During the course of this presentation, we've talked about the current situation of Pakistan and the problems that they face. Let's now turn our attention to what can be done to the possible solutions that can unlock the future of Pakistan. As previously talked about, the nation is in a state of crisis in regards to medical professionals. One of the best ways to stop the spread of infection is through the cleanliness and hygiene of a nation and its citizens. This can be done through water purification sites, national environmental cleaning days, and through government restriction on industries. One of the best ways to influence change in a nation is to target its children. Put up signs in the schools to wash your hands and the process of washing your hands. Increase regulations on healthcare facilities and the need to provide clean and sanitary rooms and equipment. Another way to benefit the country is by improving international ties with other countries. Medical devices such as the Da Vinci medical surgery device were not created by an individual, but rather from a compilation of specialists from different nations. Pakistan should look to improve its ties to other nations such as India, China, Japan, and if possible, the United States. Another solution can be found in the increased funding of medical schools and healthcare systems. Providing a healthcare system that provides the necessities to protect its people from one of the harmful diseases and viruses they face. As previously discussed, one of the leading problems in healthcare for Pakistan is through its pharmaceuticals. If Pakistan was to invite research companies and manufacturers of pharmaceuticals and provide benefits such as tax breaks and reduced land costs, they could increase the supply that's needed of medications that are in such high demand in their country. So what does the future hold for Pakistan? Should they continue on their current path, little progress will be made in the years to come. Deadly viruses and diseases will continue to plague the people, and though the world continues to progress and advance in healthcare, Pakistan will be left behind. However, should they change for the better, should they prevent the spread of infection and improve the nation's health, their future can be bright. Just like the child in the picture, who has clearly suffered so much, they too can experience the joy that he has. In conclusion, Pakistan is a nation rich in culture, but poor in healthcare. Though many problems are present, by trying to take the needed steps to improving, Pakistan can and will look to the future with hope and confidence. Thank you for taking the time to review the healthcare system with me. I hope that you have gained as much as I have through this process. Thank you and have a wonderful night.